The parable of the Good Samaritan. On one occasion, an expert in the law stood up to test Jesus. "Teacher," he asked, "what must I do to inherit eternal life?" "What is written in the law?" he replied. "How do you read it?" He answered, "Love the Lord your God with all your heart, with all your soul, and with all your strength, and with all your mind. And love your neighbor as yourself." "You have answered correctly," Jesus replied. "Do this and you will live." But he wanted to justify himself, so he asked Jesus Christ, "And who is my neighbor?" In reply, Jesus said, "A man was going down from Jerusalem to Jericho. He was attacked by robbers. They stripped him of his clothes, beat him, and went away, leaving him half dead. A priest happened to be going down the same road, and when he saw the man, he passed by on the other side. So too a Levite, when he came to the place and saw him, passed by on the other side. But a Samaritan, as he traveled, came where the man was, and when he saw him, he took pity on him. He went to him and bandaged his wounds, pouring on oil and wine. Then he put the man on his own donkey, brought him to an inn, and took care of him. The next day, he took out 2 denarii and gave them to the innkeeper. "Look after him," he said, "and when I return, I will reimburse you for any extra expense you may have." Which of these 3 do you think was a neighbor to the man who fell into the hands of robbers? The expert in the law replied, "The one who had mercy on him." Jesus told him, "Go and do likewise."
Let's go to Phuket. Love, we have to go to Phuket.
In 1940, Dr. Arthur Geschke, an American, opened a medical clinic in Phuket, a southern province of Thailand, with the support of Mr. Tan Cheng Ho, otherwise known as Luang Chanathorn Nithet, a leading advocate of the establishment of a medical facility in Phuket by the Seventh-day Adventist Church. The clinic, located on Dibuk Road, is now the Phuket Hokkien Association. A year later marked the beginning of World War II. The clinic was temporarily closed, and Dr. Geschke returned to the United States of America. 11 years later, in 1951, after the war ended, Dr. Frank Reiters reopened the clinic, which was equipped with 10 beds. Later on, it was expanded into 2 of the adjacent shop houses to accommodate the growing number of patients, and was renamed Mission Hospital Phuket. In 1962, Mr. Tan Jin Nguyen, otherwise known as Luang Anupat Phuketkarn, the patriarch of Hong Yok family, dedicated 25 rais of land to Mission Hospital Phuket. On this land, Mission Hospital was built and has remained until today. The new 30-bed hospital was opened on the 9th of February, 1965. The Seventh-day Adventist Church was constructed near the original Phuket Gateway, across from Gosit Temple. The church was opened in 1968. Then, in 1969, Thep Amnoi School, located behind the hospital, was opened. On the 9th of October 1970, the hospital celebrated its 30th anniversary by expanding its facilities to 50 beds. Dr. Paul Watson was then the hospital director. Surgeries were performed on patients with valvular heart disease, as well as Phuket's first herniated intervertebral disc patient. From 1980 to 1983, Mission Hospital Phuket faced competition from 3 newly established public hospitals in Phuket. As a result, hospital administrators fundraised to upgrade hospital services to match its competitors. Dr. Nancher Twinstra, the newly appointed head of the dentistry department at that time, donated not just her time and skills to her work, but also personally adopted 113 Thai children. In 1992, hospitals in Phuket were in high demand. Through generous donations, Mission Hospital Phuket was able to construct and equip a 3-story building to service inpatients and general operations, as well as a new outpatient building. In 1993, these new buildings opened for service. Mission Hospital Phuket is renowned for maternal and child health. In 2001, the hospital passed the Ministry of Public Health certification for maternal and child health. During the 2002 economic crisis, hospital administrators, doctors, and nurses worked together tirelessly and relentlessly through the ordeal. In February of 2003, the hospital welcomed its new director, Ajahn Somchai Chunjit, along with Mr. Peter Weeks, the new senior advisor. The hospital staff completely overhauled its operational system with valuable support and input from Phuket residents and international populations. The new system emphasized quality service and convenience for patients and their families. As a result, the hospital saw a remarkable increase in service seekers. This, in turn, has refueled enthusiasm for hospital workers. Unfortunately, in December of that same year, the hospital endured painful loss of one of its pioneers and leading doctors. Dr. Nancher Twinstra, head of the dentistry ward, passed away after having dedicated her professional life to the hospital for 23 years. On the 26th of December 2004, the Indian Ocean tsunami swept over Phuket and much of southern Thailand, killing and injuring countless locals and tourists. Aside from caring for survivors, Mission Hospital Phuket also partnered with Seventh-day Adventist of Thailand to donate food and basic necessities to survivors, as well as provided continued medical and psychological care for survivors in Phuket and nearby provinces for 3 years. From 2007 to 2010, Mission Hospital Phuket continued to improve its facilities, equipment, and administrative system. Improvements included addition of 16 inpatient rooms supported by Hongyok family and other generous supporters. maintenance and expansion of the parking area, renovation of pediatrics ward, construction of cafeteria and bakery, expansion of laboratories, addition of 4 private rooms in the maternity ward, and construction of infant intensive care unit facility. It was a time of tremendous change and improvement. In 2011, Thep Amnoi Witaya School was relocated to the grounds of the Seventh-day Adventist Church. The original school building was renovated into dormitories for doctors and nurses, as well as guest rooms. In 2012, an additional operating room was constructed, and the pre-operating and post-operating room was expanded. Moreover, the central payment office was revamped to meet international standards. The operating room waiting area was renovated for increased comforts of patients and their relatives, and guest rooms were constructed within the intensive care unit vicinity so relatives can remain close to the patients. Due to outstanding maternal and child health services, the hospital is challenged with excess patients in this ward, as safety is a prominent concern. The hospital plans to expand its maternal and child health facilities in the near future. For the past 72 years, Mission Hospital Phuket has provided quality service The increasing number of patients is evidence to the hospital's ongoing mission of providing holistic care for Phuket residents and residents of nearby provinces. The original ideals and intentions have remained steadfast and will continue to influence the hospital's operation in the future. The hospital's work has been a proclamation of the love of Jesus Christ and His command to love your neighbor as yourself.